Okay, so our final video slideshow for the unit, prenatal development, birth, and the newborn baby. Again, you can watch these in any order that you like, but this is the final one that I will do out of the three for this chapter. So the prenatal development takes place in three general stages: the period of the zygote, which involves fertilization, implantation, and the beginning of the placental growth. This typically is the first 2 weeks after conception. Many women do not know they're pregnant at this point. The period of the embryo is the next 6 weeks. And that is where the groundwork is laid for all the body structures and internal organs. The embryo at this stage is relatively vulnerable to teratogens and other damaging circumstances, and we will talk about those specifically in a little bit. The period of the fetus, the final 30 weeks, which is generally what is most of us associate with pregnancy, is when all of that groundwork is built upon, the growing and finishing phase of development. All the major structures are those are the foundations are already laid, and they are just being further developed. So quick biology lesson here. Fertilization takes place in the uterus, and implantation, the egg travels from the ovaries through the fallopian tubes. This is in a sort of run-of-the-mill pregnancy. Issues can take place at any of these periods. If that fertilized egg implants in the fallopian tube, that results in a tubal pregnancy, which can be very dangerous for women, and that fallopian tube generally needs to be removed. But in a typical pregnancy, the blastocyst implants in the wall of the uterus, and the process continues. So in that period of the fetus, again, the organ systems are developing, lungs begin to function, the heart generally begins beating around 6 weeks after conception. Into the second trimester, the organs have already been well developed, the neurons are starting to fire and develop the brain. And in the third trimester, the final third of the pregnancy, viability starts to occur where the fetus can survive outside of the mother's body. Typically, the earliest in sort of recorded medical journals is 22 weeks, but that's extremely early. The baby would need an enormous amount of care and intervention at that very early period, around 22 to 26 weeks. So teratogens are any substances or illnesses that can affect the development of the fetus. So most commonly, things like tobacco and alcohol. Alcohol is the most common teratogen that can damage fetal development. It is one of the highest causes for cognitive issues in children. Also things like radiation, drugs, prescription drugs, non-prescription drugs, illegal drugs, environmental pollutions, and infectious diseases. Sexually transmitted diseases can damage a developing fetus, as well as be passed to that fetus during delivery and cause later problems. So good prenatal care is essential for the healthy development of the fetus and the mother. And good prenatal care can screen for some of those infectious diseases and advise women what they should take, what they shouldn't take, and if necessary, provide intervention if a woman is using a substance in excess and has addiction or mental health problems, to help guide her through what could be a healthy pregnancy. So, again, prenatal development can also advise on good nutrition, managing stress, environmental stress, emotional stress, depending on the age of the mother. Prenatal care is always important, but particularly in young mothers and mothers of advanced maternal age. Lack of prenatal health care is one of the causal factors for fetal and maternal death and disease in pregnancy and post-pregnancy. So generally, good prenatal care monitors things like weight gain, the growth of the fetus, and possible complications, things like diabetes. There are several different types of diabetes, and there is a specific type of diabetes that can develop in pregnancy, and all of these need to be managed very carefully. Preeclampsia is a very serious condition of pregnancy where the mother's blood pressure raises to a very high and dangerous and potentially fatal level. And there are many other conditions and complications of pregnancy that can be monitored and in some cases treated with good prenatal care. So just quickly, typical childbirth, the cervix dilates and thins out to allow for the passage of the baby. The baby is delivered, and then also the placenta needs to be delivered. This is in a typical vaginal childbirth. There are also cesarean options, which is a surgical removal of the baby. Once the baby is born, the doctors and nurses will evaluate that baby with something called the APGAR scale. This is given immediately after birth and a few minutes after that. So it's given twice with a score of 0 to 5 at each interval. And then the overall score of a possible 10 is a very healthy, normal baby, newborn. And then some of the other lower scores can indicate issues with the child. It's just a really quick and easy assessment of the baby. It's by no means the only assessment that's done, but it's an important indicator of the overall health of that newborn. Some of the complications of birth, anoxia is any oxygen deprivation, and this can occur at any stage of life. It can occur with a newborn at birth, where the baby is in some sort of distress during delivery. The umbilical cord is compressed and the baby's not getting oxygen, but it can occur at any time. So with a young child or an adult or anyone, drowning would be oxygen deprivation, can cause anoxia, choking. Anytime the brain is deprived of oxygen, drug overdoses, that can cause damage to the brain. The brain needs oxygen in order to thrive and function, and oxygen deprivation can cause significant cognitive impairment. A breech position is anything during delivery where the baby is not coming out. Basically, if you were to pull a turtleneck over your head, and the very top of your head, sort of the back top of your head, is what it should come out first when the baby's born, and face down. So if the mother's on her back, face down, the baby's face comes out facing the ground. Anything outside of that is considered breech, which can involve a more difficult and dangerous delivery. Many babies who are in a breech position, and this is noticed again with good prenatal care, many of those babies are born with cesarean, but there are other options. But again, that's something that will be picked up with good prenatal care. So during delivery, during the process of labor and delivery, many babies are monitored with a fetal monitoring device, which is basically generally like a belt that the laboring mother will wear around her waist to monitor the heart rate and just keep an eye on the condition of the baby. There are several interventions available for women for pain control during delivery. And these options, again, would all be discussed during prenatal visits or the possibility of a cesarean delivery. So babies who are born preterm, generally before about 36 weeks, 38 weeks of pregnancy, are considered preterm. Depending on how early the baby is, many times is predictive of difficulties that baby can have or interventions that the baby might need. Again, this is where prenatal care is important. If it looks like the baby is going to be born early for various reasons, the fetus can be given medication to help develop their lungs and improve the outcome of that preterm delivery. Small for date babies are typically born at slightly preterm or full term, but are considered smaller. And there can be reasons for this, health reasons, medical reasons. Sometimes, again, the effect of teratogens can cause a baby to be small for date. Tobacco is one of the common teratogens that can cause a baby to be small for date. So there are a lot of interventions available for these preterm infants. Medical care is getting better every year for these very early babies. They are many times in some sort of incubator. They do need contact, and skin-to-skin contact is very beneficial, as well as parental training to help the parents prepare for caring for an infant that may require special needs. Babies are born with some extra reflexes that disappear as the baby gets older. These are believed to have sort of a necessary purpose. The rooting reflex, if you stroke an infant's or a newborn's cheek, they will turn their head in the direction of that finger stroke. And also, if you put something near a baby's mouth, they will begin sucking. This is very useful for feeding an infant and getting them to take milk either from their mother or from a bottle. The Moro reflex, I always tell students, don't do this with someone else's baby, but if you are holding a baby over a safe surface like a bed, and lift the baby up maybe just by an inch or two and sort of remove that support. If you sort of move your hands out from under the baby will reflexively throw their arms out in a protective gesture. And again, this is thought to be protective in case the baby falls or is dropped. Again, please don't try this experiment with anyone else's baby. Or really even your own baby. But if you can also Google this Moro reflex. There are videos on YouTube of the demonstration of this Moro reflex in a safe environment. Also, the stepping reflex, you may have even seen these videos, these YouTube or whatever videos of the walking baby. That's just a reflex. If you hold a baby upright and put their feet on a surface, they will sort of make a stepping motion. Babies spend a lot of time sleeping. Babies need a lot of sleep. They need specifically a lot of REM sleep. And we'll talk more in development about the necessity of sleep and REM sleep for infants, for children, for adults, for adolescents, for the elderly. Sleep is very important. It gives our bodies and our brains a chance to recover and rest. Babies' brains are very busy, very active, and of course their bodies are also very busy and active and growing, and so babies need a lot of sleep. Babies are also spend quite a bit of time drowsy and a little bit of time awake and a little bit of time active and awake and crying. And then these sort of percentages change as the baby gets older. Hopefully, by about 6 weeks, babies have regulated into some sort of wake sleep pattern that is regular and predictable. Not every baby is, but that's sort of the goal for the first 6 weeks of life. So, early on, parents need to learn some of these techniques for soothing a crying baby. Every baby is an individual, but generally, holding babies, rocking motions, walking. Some parents find the motion of a car or a stroller to be very helpful. Babies many times respond well to being swaddled. This is something that the nurses taught us in the hospital. We learned how to do this very quickly. It's just a way of wrapping the baby relatively tightly. It can be done with a blanket, but of course nowadays you can buy actual swaddling little apparatus that will sort of Velcro the baby into this little papoose. Some babies like pacifiers. There's a lot of debate about the benefit and the harm of pacifiers. Generally, in early infancy and the first year of life, pacifiers can be beneficial. But down the road, of course, there's the battle to get rid of the pacifier as the child gets older, which can be difficult. Baby massage is also something that can be beneficial to babies, and there are individuals who can help with infant massage. Talking softly, playing soft music, singing to babies are all other techniques that can be beneficial. Newborns are extremely sensitive to touch. Their nervous system is in the process of developing and sort of finishing development. So babies are very sensitive to touch. They do experience pain. Anesthesia is necessary if procedures are performed on the baby, which was not always understood. Fortunately, now we know that babies do experience pain, and anesthesia is necessary if the infant needs a procedure. Newborns prefer sweet tastes. They can locate their mother by smell, generally from birth. So their taste and smell sense are very well developed. They hear very well. They can hear prenatally. They generally are able to recognize the voices of their adults in their maternal home before they can recognize the maternal voice. And this is because what they're hearing of the maternal voice in utero is slightly distorted, but they can recognize familiar sounds from a very early age. Newborns do not see very well, and if you've ever been around a newborn, you'll notice this. Their vision is not focused. They see well very, very close up, but not much beyond a few inches beyond their face. Their vision does develop very well in the first couple of years, and they can begin to see better and better as they get older. When you click on this link in the PowerPoint, you'll see this little video about habituation in infants. How do we know that infants are getting bored? How do we know what infants are paying attention to? How is that research done? This short video demonstrates how we test for habituation in infants. It's kind of interesting. So, new family adjustment. If the maternal and paternal family are bringing the baby home, there's a recovery period certainly for the mother, and there are a lot of hormonal changes taking place. There are dramatic changes in schedule, and all of this can result in quite a period of adjustment for new families. And so social and family support is extremely important. In the next couple chapters, we will talk about the importance of family support and how that has changed over time, particularly in American society, and what might be done to help mitigate some of the stresses of early parenthood.